Good evening, everyone. Thank you so much for joining us tonight. Welcome to our webinar. My name is Christy White. I'm the Event and Marketing Manager here at Kids & Company, and I'll be moderating today's session. We're very fortunate to have Dr. Dina Kulik facilitating our webinar today. She is a mother, pediatrician, and a pediatric emergency medicine physician in Toronto. She's the founder of Kidcrew, a multidisciplinary clinic for children. She's Canada's leading child health media expert, and her greatest joy is her family and being a mom of 4 active, healthy boys. We've received a lot of questions in advance from our attendees, but we also will be taking questions live during the session. So any questions that you have for us, you can use either the Q&A or the chat function, and we'll do our best to get them all addressed. So I will read some of the questions that we've got in advance first. We have a lot, of course, that are COVID related, so we can sort of dive into that first. So our first question is, what are the current number of children, infants, toddlers, school age, affected by COVID, and what is the severity of those infected? And I'm sure you don't have this exact answer, Dina, but just some insight.
Yeah. Welcome, everyone. Nice to see you all. I'm so glad that you guys are having me chat, and I'm always happy to do that and spread some information. So, I mean, in terms of real numbers, we don't really know what the exact numbers are in terms of COVID cases. We don't think there's many. The testing is not ideal for kids in particular. We know that the test is not as accurate as it is with adults. So though many kids are being tested when they're symptomatic, or if their parents have COVID or someone else they've been exposed to is sick or has confirmed COVID, we know that the test is not as accurate. So I wouldn't really hang your hat on the numbers of kids that have it or even numbers of adults that have it, to be honest, because many people are asymptomatic as well. So we know that there are kids that have it. We know that there's adults that have it. But what is definitely true is that most people are pretty healthy with it and even asymptomatic with it. So most likely the vast majority of people that get COVID, you will never know it. They will never know it. They might have no symptoms at all, or very minor fever or runny nose or cough or sore throat, stomach flu kind of symptoms. But most people are completely asymptomatic. So actual hard numbers, I don't know, but I could tell you that kids are not getting very sick with it. Very few kids have been hospitalized, even across the whole country. So we're doing quite well here in terms of the numbers. And again, in general, they're staying pretty healthy.
Great. And so along the same lines, what are the current guidelines? And I don't think we really know this yet, but what are the guidelines to be carried out by schools that are recommended by health officials to ensure a safe return back?
Well, it really depends, city by city, state by state, municipality by municipality, to be honest. We're in Ontario opening up, phase 3 in Toronto, coming. Oh, my Siri is saying hi. Hi, Siri. Why does Siri keep going on? That's going to be weird.
We can't hear her on our end.
Oh, it's weird. She keeps popping up on my screen. What do you want to say? What do you want to say? I don't know what she's responding to. Might have to turn her off. But so we're entering phase 3 in Toronto on Friday. But before that, a lot of other places have opened with phase 3. And that means that you can have more people in closer contact, indoors, outdoors, etc. We think that kids will be better off if we maintain some distance when we go back to school, depending on what that looks like in your city, etc. My kid's school hasn't announced yet what that looks like or what they're going to do necessarily, but we're hoping they go back. I know some school boards have announced that kids will go back, every other day. Some kids will go back in the morning, some kids in the afternoon. Regardless, ideally, we're going to keep numbers low, similar to how daycares are. Oh my goodness, I don't know if you just heard Siri there. We'll keep numbers low. She's like, hello, what are you bugging me for, Siri? We'll be keeping numbers low, similar to daycare experiences, right, with smaller classroom settings, ideally, but not all schools can accommodate that. More outdoor time, which is doable, but depends, for sure, like in Toronto where I am, that's only going to be doable for a couple months of school, and then it's going to get too cold to do so. So ideally, kids are in smaller cohorts. They are physically separated, but not in some crazy, scary way. I think a lot of parents are really scared there's going to be like walls up and, we're going to be having kids walking around like this and making sure they don't touch each other. I think that's unnecessary. And actually, Sick Kids put out a revised recommendation actually just today, which I can share, you can share after. I actually just shared it on my Instagram story just now, saying that they do still recommend going back to school in September and recommend going back to daycare, as you guys already are. And the restrictions should be minimal so as not to affect the mental health of these kids, that it could be very scary, right? If everyone's forced to wear masks and they're forced to like keep distance, and all these things can be very fearful for children. So their recommendation in a very brief summary is go back to normal classrooms, minimize the amount of people per class if you can, cohort those kids as best you can so they're not, mixing with tons of other kids, exactly as the daycare setting is, having lots of hand washing, making sure if you're unwell, you don't come, and then you stay away for X number of days, minimizing the amount of adults coming in and out of the space. It's really what everyone is doing, like what you guys are doing so judiciously in a daycare setting. Similar recommendations are going to be put forward for schools, but because schools are municipally and provincially mandated, it's going to look different. And the amount of COVID we have in Toronto is going to be very different than the amount of COVID we have in Kingston or Ottawa or BC, et cetera. And the numbers keep changing, right? Like in Toronto, things are quite stable, but we do have a rise in number of cases in Alberta and BC. What this is going to look like in 6 weeks when school is meant to start, I don't know. Things can be much, much better or much worse. So we'll see.
Yeah, a lot up in the air.
Sure.
Along the similar lines, what age are masks suitable for children? This mom's concern is that a 2-year-old and a 5-year-old would be constantly adjusting the mask, not donning it properly, which defeats the purpose. Are there any tips? And we actually did put a blog post out on our website for anyone who's looking for some tips there, but from a medical standpoint, do you have any advice on this?
For sure. So masks are recommended for only kids more than 2 years of age. I would not be putting a mask on a kid less than 2, period, end of story. They're not going to keep it on well. They can't express themselves well enough to tell you if they can breathe or not breathe. And you're missing half their face when you're wearing a mask. So it could become dangerous. And similarly, kids that have developmental challenges, kids that have breathing issues, et cetera, you don't want to put masks on these people either, adults included. In Toronto anyway, it's mandated that kids wear masks if they're more than 2 in settings that are outside of their bubble. And for example, if they're going grocery shopping or they're going to stores with parents, and again, they're inside and they're not able to maintain that 2 meters of distance. So that's the recommendation. That's actually the law in Toronto, and across, again, different cities, different provinces, the rules are different. So you want to make sure you follow the rules wherever you're living. For, a 2-year-old or a 3-year-old, do I think they can reliably wear a mask all day at school? Absolutely not. I don't know how even a 7-year-old is going to wear a mask without fiddling with it. I wear a mask all day for a living, and even I take it off periodically throughout the day. So, I'll do a visit in person where I see a healthy baby, for example. I'll go to my office, I'll do a phone call, doing a virtual visit, and back and forth. And I'm taking my mask off many times a day because they're incredibly uncomfortable. A child, you can't expect them to really even understand the concept of wearing a mask. So how could you expect them to wear it without fiddling with it? It's impossible, truly. I wear a mask for a living, and it's very, very annoying. It's very cumbersome. So I think, when possible to wear a mask, again, if you're going grocery shopping, if you're taking your child to a store, if you're, in front of a teller or something, I think it's reasonable to wear one. But all day, every day at school, I don't foresee that being a possibility. That being said, there are definitely schools across the world that kids are mandated to wear masks. China, for example, and the kids have been wearing them, and it is what it is. It's new for them, and it's working. I don't know. So I guess you can get used to it, but masks are really, really not comfortable. Hopefully we take them off when we're outside and we're getting lots of outdoor time, because we know distance and fresh air, just being outside in general, we think the transmission of COVID is far less. So the biggest thing is really wash your hands. Don't go if you're sick or if there's anyone sick in your family, because you could be a carrier, despite having no symptoms. And again, diligent hand hygiene and maintaining distance when that's possible. But again, for little kids, like you talked about, a 2-year-old, I have a 2-year-old, there's no way if I said go back to school, he would sit 2 meters from his friend. Absolutely not. He'd go right up and kiss his friend. He'd be so excited to see his friend. So it's going to be challenging. Look, we're going to have a rise in COVID cases when we go back to school. There's no doubt about it. But the idea really is, cautiously, slowly going back to not exactly normalcy, but not rushing back. The fact that we've phased in going back to daycare, phasing in going back to school, phasing in going back to work settings. So we're not just jumping in. That's hence the phases that we've been doing. So if we're slow and cautious with it, hopefully we won't have a big rise in cases, and we'll see what that looks like. Daycares went back a few weeks ago. We've not had a dramatic rise in cases of COVID. And that's incredibly powerful and important. And hopefully it maintains that way.
Absolutely. And then our next question is the risk greater for a child with asthma to be affected by COVID?
I get this question a lot, actually. So we hear about adult populations where people with chronic respiratory problems, chronic lung problems, all sorts of issues, cancers, heart problems, etc., are at risk of getting more sick with COVID. We've seen that in adult populations. Though we would say that if you have a chronic health concern, especially a respiratory one, that you would be at higher risk of getting sick with COVID, not just getting COVID. I mean, COVID is the same risk for everybody. Everyone seems to be at equal risk of getting it, though again, kids seem to be maybe not getting it as much, or maybe they're just not getting as sick with it. People with respiratory issues that are kids don't seem to be getting very sick. And there's been cases in the world of kids with lung transplants that got confirmed COVID that did just fine. So we are cautioning people that have respiratory issues, but we haven't actually seen that those kids with asthma, for example, are getting more sick. The challenge, I think, more for kids with asthma, my kids included, my kids have asthma as well. I have 4 boys, by the way, for anyone who doesn't know me. So my kids are 2, 5, 7, and 9. So I'm in the trenches with you guys, living the same thing as you with young kids at home during all of this craziness. But 2 of my kids have asthma. All my kids take puffers, but 2 of my kids have asthma, quite regularly needing puffers. My concern is not that they're going to get COVID and they're going to get really sick, but rather when they get their normal coughs in the fall and winter, they are going to be assumed to have COVID and they're going to get kicked out of school for 2 weeks. So my expectation for the fall and the winter for them, and for many kids, to be honest, is they're going to get the normal viruses that kids get in the fall and the winter because the testing is imperfect. And like I said, a lot of kids that I'm sure have COVID are testing negative for COVID. What do we now do? There used to be some measure of acceptability of your kid has a runny nose or had a fever a day or 2 ago. They can go back because now they're well. Now, because we know that the incubation period is at least 14 days and that you could be asymptomatic and yet still pass on COVID to other people for 14 days, maybe longer. I think it's probably longer, but we'll see what the studies show. What does that look like for the kid that has a runny nose? Do they likely have COVID? I don't know. If we test them, they're negative. Do they have COVID? I still don't know. So do those kids necessarily have to stay home for 14 days now? And if anyone in their family then gets that same illness and they're sick, can that kid come back or can that kid not come back? That is the challenge for fall and winter. For me, much more, again, COVID for me is not really causing much illness for kids, but it's going to be an incredible nuisance when kids go back, parents go back to work, and now they get sick. What does that mean now for that parent who now has to take potentially 14 days or more off of work to be with the child, but they went back to a physical workplace, right? Now, if you're working from home, I mean, a lot of your families are not working from home now. They went back to a physical workplace perhaps, or maybe they're working from home. But if you go back to a normal workplace and you get back into the thing of going back to work and, working without your kids around you as they were doing before, what does that look like now when your kids get a runny nose? And they're not sick. They're like not very sick, but they have something. What does that now look like? And that's going to be a huge burden for families in the fall and the winter, I suspect, because everyone gets a runny nose at some point.
Absolutely, especially kids.
The
next question is, what are the transmission risks from toddlers to each other and adults?
We don't know. We simply don't know. There's been some reports of kids not being super spreaders, as people term it. I don't really know what that means exactly. We know that kids pass on viruses to parents and parents to kids. Flu, for example, kids very readily get flu and they very rarely pass it on to adults, but adults also very easily get it. So there's lots of transmission. The thing, as I was saying before with COVID, that a lot of kids are testing negative, but parents are testing positive. So are they giving it to their parents? Are their parents giving it to them? Probably, but the testing isn't good for kids. So we don't really know what the rate of transmission is. I can tell you from my own experience with my patients, there's absolutely no doubt that lots of kids are getting it. I've taken care virtually and in the eMERGE as well, of many, many kids over the last 5-6 months that had fever, that had pink eye, that had vomiting, that had diarrhea, that had coughs, colds, etc. And they were exposed to nobody outside their home, like nobody. The number of kids with roseola that I've taken care of in the past few months is outstanding, like 5-6 a day, every single day. And roseola, as you guys know very well from a daycare setting, is really, really common in kids where kids are touching or coming in contact with other kids. It's not airborne, not as far as we know. It's usually spread by droplets. If your child hasn't left the home and hasn't seen any other kids and they're getting roseola, it's not roseola, it's probably COVID. but a lot of these kids are testing negative, and their parents might have coughs, colds, fevers, etc., and they may test positive. So suffice it to say, I think kids are giving it to parents and parents are giving it to kids, but kids are staying relatively healthy and the test is imperfect for them. So we don't really know what the transmission rates are.
Makes sense. And so probably we're not sure about this one either then, but what are the long-term effects of children having COVID?
We have no idea. I mean, COVID's been around for 6 months, so I have no idea. I mean, it doesn't seem to be really significant. There are certainly some kids, but very, very few kids that get, these two, concerning conditions. One is called Kawasaki disease. One is called multi-system inflammation. And I'm sure people have heard about that on the news, et cetera. Not as much in the last couple of weeks, but there have been some kids reported around the world that get prolonged fevers. Some kids have had, heart concerns, heart conditions with aortic aneurysms and other kinds of issues. And some kids have multi-system inflammation where they might have heart concerns or lung or liver or brain, et cetera. Very few people. Like, this is a very, very small cohort of people in the entire world. And that seems to fall weeks after infection. So when you look at these populations, the kid may have had a fever, may have had a runny nose or some viral symptoms, or parents or other people in their lives did. And weeks later, they developed this inflammation. So and some adults, we've seen this as well. So it's possible, I think it's likely that some people way after the illness is not in its acute phase, weeks or months later, they develop some kind of weird inflammation. But what is that going to look like in 2 years, 3 years, 10 years? We have no idea. I mean, in the history of coronaviruses, we've not seen any long-term impact from coronaviruses. They cause 10 to 15% of the common cold. So if you were to look at like historical numbers, there's no reason to suspect that it causes anything long-term developmentally or otherwise, but it's novel. We just don't know. I mean, SARS didn't cause any long-term, developmental or behavioral challenges of people that got it. A lot more people died from SARS if they got it. And again, it was more older people, but of the small percentage of young people that got it, there doesn't seem to be any long-term impact. So probably okay. I'm optimistic that it's not going to cause those kinds of issues. We'll see. Like all of this, it's all novel, right?
Exactly. And so we'll move away from coronavirus here and get on to some new questions. So we have a question from a mom who is wondering how to tell the difference between normal, in quotations, defiant behavior that can be expected from a 2 to 3 year old, and then how to tell when that behavior is beyond normal and more indicative of a behavioral problem.
Well, I mean, it's all behavioral, right? I mean, whether your kid is having temper tantrums and that's normal, or your kid is having kind of more aggressive behavior, but it's all stemming from temper tantrums, it's all the same normal, if that makes sense. I mean, there's not really diagnosable mental health concerns that present it to, like, for example, oppositional defiant disorder or bipolar disorder. Those kind of things don't present at age 2. So it is sort of a continuum, and some kids have really significant temper tantrums that are really difficult to manage. And, we start thinking about psychologists or social workers or parenting consultants. And then there's kids that have like pretty benign, easy to control. They're more temperamentally just easier kids to parent. It's all a continuum. And I wouldn't say there's anything that's really abnormal about a 2-year-old that's tantruming, to be honest. Very rarely do we see, again, like mental health concerns at that age. Not to say that depression, anxiety, et cetera, doesn't exist at that age, but it wouldn't really be the cause of tantrums. My biggest trick about tantrums in general is giving a lot of attention for calming and for controlling the behavior for the child, and less attention for what I call the crazy. So you want to turn your attention from the crazy to the calm. So what I mean by that is, I have a 2-year-old, if my 2-year-old has a temper tantrum, as long as they're safe and he's okay, I literally look in his eyes and I say eyes to eyes, because they're crazy and they're flipping and they're whatever. I say eyes to eyes, Austin. He looks at me. Or if he doesn't, I just walk away anyway. But I say eyes to eyes. When you're ready to talk, I'm ready to talk. And I turn my back and I walk away. I literally sort of passive aggressively walk away and don't give attention for it. So I call it active ignorance. Now, this doesn't work for every single kid. This is like really kind of a blanket thing. But for most kids, what they're looking for is attention when they're going crazy, especially with like these more behavioral kids, which is what I'm hearing, that from this particular parent. For these kids that have more aggressive or difficult temper tantrum kind of stuff, usually it's attention seeking and or sleep related, which we'll talk about in a second. But for an average healthy kid, they want attention. And I want to give them lots of attention, but I don't want to give attention for the crazy, right? So I turn my back and I walk away. After a couple of days of doing this, most kids will decide that they understand the concept, they want the attention, And then within like a day of doing this consistently, my kid would come out to me and be like, mommy, talk, let me talk. And then I turn attention back to Austin. I say, good job for expressing yourself, good job for calming down. And I get down to their level and I say, okay, now let's talk. Basically, you're putting a lot of energy and attention and focus on the calming and not the temper tantrum. Again, this doesn't work for every kid across the board, but it works for the vast majority of them. But what you want to do is be really mindful of what you're doing attention-wise and for what behaviors. Because a lot of us as parents, we focus a lot on the negative. There's a lot of no, and there's a lot of correcting of poor behavior instead of giving a lot of attention for the positive. So I think if you think through what are you doing in terms of attention for your child, oftentimes there's a lot of attention for the negative behavior. So correcting poor eating, correcting poor sleeping, correcting poor behavior. And then when they're being good, a lot of us kind of step back and we're like, okay, be quiet, like don't give attention for this. But it's the opposite. When a kid is playing independently, calmly, nicely, they're being nice to their siblings, they're being nice to their friends, they're being kind at the dinner table, whatever the case is, that's when I recommend giving tons and tons of attention. So good job, Austin, you say it so nicely. Wasn't that such a good piece of whatever, broccoli? You want to give a lot of attention for the positive. And I find very commonly parents are silent on the positive and give tons of talking to the negative. Does that make sense? Mm-hmm. So yes, focus on the calm, not on the crazy. And of course, if you're having still like lots of meltdowns, you're at your wit's end, which a lot of times happens. You're just like, pulling your hair out because you're so frustrated by all this stuff. That's when it's potentially time to talk to your doctor, your healthcare provider. There's parenting consultants that are great. There's psychologists, there's social workers, there's lots of people like that. And then, one of the services that I provide, that my team provides in our membership, which is called the Parent Playbook, is exactly this. So we're providing advice from our team of experts about, issues with sleeping, issues with feeding, issues with temper tantrums. And, if you have questions and concerns about this in our private membership, you can ask this direct question to any of our members. And we have videos, and we have PDFs, and we have audio, and we have all this advice and content for you exactly based on this, which is what pretty much every parent of a young person, toddler, baby goes through all these various challenges. I mean, no one has no questions. No one has no challenges in parenting, including myself. I mean, I reached out to my own friends and physician to ask questions, even though this is what I do for a living. Parenting is not easy, period. End of story. Like no one has an easy time. No one has no challenges. Everyone has some issues with sleeping or feeding or behavior or whatnot. So it's very common, totally normal. Even people like me who do this for a living, I have 4 of my own kids, have challenges and questions around these various topics. So anyway, so you could definitely check out the Parent Playbook as well for lots more advice if you want.
Absolutely, and we'll talk a little bit more about that at the end as well. Our next question is, my son is 30 months old and has a speech delay. He doesn't understand English and has never been in a structured environment like daycare. How long do you think it may take for him to adapt? It's very stressful for him right now.
Yeah, I'm sure. I'm very sure. So, I mean, there's a lot to unpack there. I don't know that there's a real big blanket answer. I mean, for sure, if your child has any kind of delay, whether it's speech or physical, fine motor movement in terms of their whole body, like walking, crawling, etc., talk to your healthcare provider. That's really important that your healthcare provider, your physician, does an assessment to see where they're at. I could say that at 30 months, at 2.5, a child typically has tens of words, so 20, 30, 40 words, etc., and starting to be, actually by 2.5, they should definitely have 2-word sentences. Simple things like mommy up, let's go, milk please, things like that. By 3, your child should have 3-word sentences or more and hundreds of words. Some kids that don't get exposed to English, if we're talking about Canada, could have delayed language in that language. But then I would expect them to be fully lingual in the language that they are learning at home. So for example, let's say your family talks in French at home, and then they're going to a daycare environment that's in English. They may not be up to speed with their English-speaking counterparts in daycare. They may not have those tens of words or 2-word sentences in English, but they should absolutely have tens of words, 2-word sentences in French or whatever language you speak at home. If your child is delayed in all languages, including the language that you speak at home, that's delay. And then we're thinking about, what could that be? Could that be just an isolated language delay? Could it be both language that they're expressive but also receptive? So are they understanding commands? At 2.5, a child should have the ability to follow a 2 or even 3-step command. So for example, go upstairs, get your socks, and come down, right? At 2.5, a child should be able to understand that, or at least the 2-step, go upstairs, get your socks, as an example. And so we think about a couple of things. One, is there a hearing challenge, in which case your physician should order a hearing test, make sure that their hearing is okay. And then globally, in terms of development, right? Because a lot of children that have speech delay, it could be hearing, it could be just isolated speech delay that we just have to work on with a speech therapist. And it could be, or I should say, it could be something, a developmental challenge like autism. So it's really important to review that with your doctor. And if they're not speaking many words in any language, including the language you speak at home, and for sure, if they're not following commands, as you would at 2.5, then that's definitely a reason to discuss with your doctor.
Perfect, thanks. Our next question is, what are some of the symptoms when a baby is teething?
Teething does everything and maybe nothing. We don't know what teething does, right? Parents think that everything is teething. So if a kid is fussy, if they're not eating very well, if they're not sleeping very well, if they're putting their hands in their mouth, if they're drooling more, if they have rashes, if they have bum rash, if they have rash on their chest, if they're sneezing, if they're coughing, they have runny nose, everything is teething to everybody. And we have no idea because kids teeth for 2 years. So we blame everything on teething, but it could be that your child really isn't actually uncomfortable at all, but we just think that their diaper rash is related to teething. And there's no way to prove it or disprove it because, again, every kid teeths for about 2 years. I mean, no doubt when kids are, really having discomfort with their teeth, a lot of kids will drool more, they'll put their hands in their mouth. Though again, a lot of kids self-soothe with putting their hands in their mouth. So it may not actually be something that's painful. It might be something that they're just soothing with. Some kids suck their thumb or chew their hands or whatnot. Some kids will have elevated temperature. Kids do not get fever from teething. So this is not a thing. If you take your child's temperature and the child's temperature is 38 degrees or 100.4 Fahrenheit, it's not from teething, period, end of story. Those temperatures are from viruses or bacteria. It's not from teething. Teething can elevate your temperature. So for example, if a child's temperature is normally like 37, it could be like 37.4 or 37.5. It could be elevated. But to cross the threshold of fever into 38, that is not from teething. Some kids won't sleep as well, but again, we blame everything on teething. So if a child's not sleeping well, a lot of parents I find, and me too, we're like, oh, it's teething, I'll just give them Tylenol or Advil or whatnot. But oftentimes it's unrelated. It could be just developmental changes or sleep regressions or whatnot. When in doubt, I find that for me personally, I would give my child a dose of Tylenol or Advil or something. And if they were much better 20 minutes later, I had my answer. That is, at least part of what was going on. But if you do something like Tylenol and they're really not feeling much better at all and it changed absolutely nothing, it's not likely that it's like just pain related. A lot of people also think that when the tooth is about to break out of the gums, that's the time that they have a lot of pain. But the tooth will rise through the gums, like way below the surface of the gums for months. And I find sometimes the tooth will pop out and you didn't even notice that they were uncomfortable, but they were uncomfortable like a month ago. So it's not really predictable, but where the tooth is in the gums, where that causes pain, if at all. Obviously, if you're giving medicine 4 or 5 times a day for weeks and months, that's a problem. See your doctor, make sure about that. But I mean, for me personally, I found that, my kids would seem to be uncomfortable for a couple of days. I would give, medicine once or twice a day. And then boom, they were better. They just felt better, whether they got a tooth breakout or not. I don't think, for me, I never really saw a tooth come out when I thought they were teething, actually, for any of my kids. And then it seemed better for a couple of days or weeks or months even. And then they seemed to be miserable again. So I would go through that process again, especially before bedtime when they were no longer distracted. I'd give a dose of medicine and then maybe they would sleep the next 6 or 8 hours and then maybe you may not wake up again. And then things would be better for a couple of weeks or a month. So you just kind of play with it. Again, you don't be doing medicine 4 times a day for months, and that's definitely the time to see your doctor, make sure nothing else is going on. But for a couple of days, once or twice a day, that's really typical. I mean, I did that often with my kids because I just didn't know.
Perfect. And would you recommend fluoride in toothpaste for a 2-year-old or older?
Probably, but in a very, very small amount. So these recommendations seem to change a lot. It was for a period of time the recommendation was to not use any fluoride till kids were 3, and then there was 4, and then people were saying use it at 1 year of age. What I personally do is I give once a day, small amount of fluoride to my 2-year-old, a grain of rice. We're talking teeny tiny amount. And otherwise I use just water. I use fluoride-free toothpaste. The reason why it matters is because fluoride can help prevent, cavities and tooth decay, which is good. But if you have too much fluoride that you're ingesting, it's not good for your bones. There's something called fluorosis, and it's like if you have too much fluoride. So it's a bit of a balancing act. It also depends on your water supply. So if you have a water supply that has fluoride in it, and your kid's drinking that kind of water versus drinking like bottled water, for example, they're getting some fluoride, so they're already somewhat protected. So if you're going to give fluoride to a 2-year-old, I would suggest a grain of rice, a teeny tiny amount, once a day. If your dentist says do twice a day, do twice a day. Certainly when they can start spitting out more consistently, which most kids cannot do until 4 years of age or later. Even my 5-year-old now, he like goes, like nothing comes out. He pretty much swallows it. If they're taking in a lot of it, ingesting a lot of it, then I would not be doing it. So it really just depends on your own child. But no 2-year-old that I've ever met can spit out a mouthful of toothpaste. They just don't know how. They don't have that skill. So if you're going to use it, assume they're going to swallow it, and therefore you don't need to swallow it.
Perfect, makes sense. Our next question is, how do you address a 3-year-old crying in the night? It happens 4 nights out of 7 and crying when they wake up every morning and every nap time as well.
So sorry, they're waking up in the middle of the night crying as well?
Yeah, crying in the night and then also when they wake up in the morning and after each nap, a 3-year-old.
Oh, I see. Yeah, I mean, some kids will just wake up crying and for some reason, like they don't wake up seeming happy, they wake up crying. But again, this would be a behavioral issue, very well suited to the parent playbook. This is a common thing where kids wake up crying. But it most likely, again, from knowing very little about the story, the child's probably overtired because most times when you wake up, if you're crying, it's because you're not well rested. You should typically wake up pretty happy if you're well rested. You know, like most kids, especially at 3, will wake up and like play in their crib or play with stuffed animals or sing to themselves or talk to themselves. I wouldn't expect them to be waking up like miserable. So probably they're under rested. And there's so many different things to think about with that. And, you know, certainly something we could address in the parent playbook, of course, or if they want to send in, you know, more questions, I can go through that more fully. But, you know, at 3, what I'm looking at is that kids are getting somewhere between 11 and 13 hours of sleep within the 24 hours. Ideally, they're getting about 12 hours at night and a couple of hours during the day. You know, that's a really good scenario. And so if they're getting much less than that, that's going to lead them to be overtired. If they're overtired, they're going to have a harder time sleeping. They're going to wake up more frequently, etc.
Perfect, thanks. Next question is, what can I do to help my baby leave the pacifier, so stop using the pacifier?
So it depends on the age of the child. If the child is, you know, I would say 18 months or older, what I would typically do, actually even 12 months or older, you know, if parents are over it and they don't want the pacifier anymore, you can do either completely cold turkey and just say like it's gone, or it's going to babies, you know, we're going to donate it to this baby or that baby that you may know. Or if parents have another child coming, they can say that the pacifiers are only for the babies, or, you know, sometimes like kind of giving it to someone else could be helpful. And like it just goes away. If parents want to be done with it, just make it done. Like don't have it sometimes around, sometimes in dad's back pocket just in case. Like make it a rule, you know. I think, you know, one of my best recommendations for parenting toddlers in particular is be really consistent and predictable. I say, you know, there's something called the no, okay, fine phenomenon. So they're like, no, don't do that. No, don't do that. No, do that. Oh, I'm just so tired. I have no patience for this. Fine. No, okay, fine. And what happens is then no doesn't mean a lot. So like, no, you can't get the soother. No, you can't get the soother. No, you can't, oh, whatever, you're crying. I'm in a grocery store, here's a soother. But if you do that, then kids don't really learn, like, what are the boundaries? Like, what are the rules? So kids have to understand the rules. And, you know, I mean, you know what I mean by rules, like just, you know, you do X and we do Y. What is it? What can I do as a kid that's X? And what is going to be the resulting Y from all caregivers, right? Not just, you know, one parent or the other parent. It could be grandparents, it could be caregivers at daycare. Everyone should be on the same page so that the child knows with predictability what is going to be the result of X, Y, and Z that they do, right? So if parents want to get rid of the soother, I would say just get rid of it. Again, ideally giving it to someone else they know or something like that, donating it or whatnot. What a lot of parents have success with is having it so it's just in the crib time. So they only get it for nap or they only get it for bedtime. And then you could wean off of that at some point. For me personally, I'm not really against soothers, especially when they're sleeping. Like I think it becomes something that we think about in terms of infection and stuff when you have a soother or thumb sucking for that matter, you know, when you're out and about because they fall on the floor and they touch them and it's just gross. I mean, there's a lot of stuff happening in their mouth. So that's why I would keep it to, you know, after you've washed their hands and they go for nap time or bedtime. So after I would say about like 18 months or so, ideally it's not happening outside of the crib, especially again, if they're in daycare settings or school settings or whatnot. Some people have success by like still having the plastic thing, but you cut off the nipple part of it because some kids just want to hold something. For them, it may not be so much about sucking, but it's about like the physical thing. It's like some kids really like bottles at like, you know, 2, 3, or 4 years of age. And it's not that they really want the milk per se. Some of these kids don't even drink milk from it. They just kind of leave it in their mouth. But it's that holding of the physical thing. You know, it could just be as well just be the nipple or even just the cup. So some families have had like get rid of the bottles at night, for example, but just giving an empty bottle It's not even the milk they want, it's just holding that physical thing. So to think about, giving them something else, whether it's like a lovey or, just giving them the plastic part of the nipple, the plastic part of the soother, etc., as kind of like a weeding off kind of practice. But starting with either, getting rid of it at daytime, just in the crib for nap or bedtime, or cutting off a part of it, or just saying, done, we're done with this. But whatever it is, be consistent. If you say you can't have it during the day, but you keep it in your back pocket when you go to the grocery store, the kid's not going to understand the rule. They're going to beg for it more outside of those bedtimes.
Makes sense. Perfect. Thank you. Our next question. My son is 25 months old and still puts everything in his mouth, including his hands. He was hospitalized in January with croup, and for that, both of those reasons, she's hesitant to have him interacting with other children right now. Is that a valid concern?
Yeah, it's valid, but you're not going to be able to change it, really. So croup you probably got from another kid coughing, to be honest. Probably less so from his hands, because it's a respiratory virus you get from, a kid come from droplets for sure, but it's often from another kid coughing nearby, etc. Some kids are just really oral, I sucked my thumb till I was 7. My kids all suck their thumbs, actually. And some people are just really oral. They just use their hands for self-soothing. And some kids explore with their mouths, That's why a lot of babies put things in their mouth. And it's hard to say to a 2-year-old or any age kid to be like, just don't do that, because they don't get it. They're not doing it because they're not doing it on purpose. They're doing it because it's their natural inclination. Just like some adults will chew on the back of pens, on like a pen cap, or some, adults chew their nails. Of course, we can work harder at stopping these behaviors as adults when we have insight into them. But I'm sure you guys all have friends that chew the back of pens and they don't even know they're doing it. It's just part of their thing, they're thinking and they're chewing on that pen cap. So easier said than done. You're not going to be able to change the fact that he's a very oral kid. He's probably just going to be a kid that, explores with his mouth. But that's the kind of kid that I would do a lot of education, as all kids, but especially a child like that, about proper hand hygiene. So, if you're going to put your hands in your mouth, you need to wash your hands well first. And here's what that looks like. I'm going to wash for 30 seconds. We're going to sing a song together, role modeling that for your kid so they can see what that really looks like. Not just like in, wash, done, but really let's sing happy birthday together, really modeling that behavior and making them really aware that there could be, lots of things, lots of bugs, or however you want to describe it to them, on inanimate objects that are around, So chewing on your hands is one thing. Picking up random toys off the ground and putting in your mouth is another thing. And so one way that I like to explain to kids what germs are and what germs look like, because they don't understand that concept. You can't explain a virus to a 2-year-old not well. I like to think about sparkles. Sparkles. I was going to say sprinkles, but yeah, sparkles. So if you think about you got a birthday gift or a birthday card, you open it up and there's sparkles inside. Sparkles go everywhere. They're on your nails and your hair. They're all over the surfaces of everything, and they're really difficult to remove. That's germs for a kid. And in fact, some adults don't get it until you think about it like sparkles. They're difficult to get off of things, and they're kind of ubiquitous. You have one card, you pull out the thing from the envelope, and suddenly there's sparkles everywhere. That's going to be viruses and bacteria. So you can play with sparkles with your kid and show them that it could be on the floor, and it could be on that toy, and it could be on their hands, and it could be in their hair. But we want to make sure that we don't ingest those sparkles. So therefore, here's what we're going to do to prevent the sparkles from coming into our body. We're going to wash our hands. We're going to clean off toys. It'll give them an example, a metaphor, if you will, of what it's like when you have, these ubiquitous viruses on different surfaces, and why it now matters that you shouldn't put things in your mouth. Because if you just say you shouldn't do this, or you can't do this, they're like, but why? Give me a reason. The same as you. If someone tells you you can never go to the restaurant again and doesn't ever explain why, you'd be like, I don't get it. What? You would probably want to go to the restaurant again. Just be curious about why it was that your friend said don't go to the restaurant again. People want to understand why X, why everything. Toddlers especially are like, what, who, why, how. That's what they want. They're learning about the world. So if you explain it to them in a way that they understand it, now they're going to have a vision of what that means. They're going to think twice about putting the thing on the floor in their mouth, because they're going to think about the sparkles.
Perfect. Thanks. Our next question is, will getting the normal viruses be more important for kids returning to daycare, boosting their immunity and everything like that? Yeah,
I don't know. There's this weird dogma going around that if kids don't go back to daycare, or they've been out of daycare for a few months or out of school for a few months, that suddenly they're going to have weakened immune systems. And I don't know why people are worried about that. Our immune systems are on and off. If you don't get exposed in X number of weeks or months, your immune system shut off and everyone's going to get super sick with everything. I'm really not worried about that. There's plenty of kids around the world that never go to daycare. and don't go to school or go to camp or anything else until, they're school aged. There's plenty of kids like that. Probably more than half the world is like that, actually. It's very much like a North American thing that we go to daycares and camps and, nursery programs and things like that. Around the world, many kids, hang out with grandparents by and large, or parents, and then they go to school in JK or SK, and they didn't have those 3 or 4 years of immunity boosting. So there's no doubt that when kids are exposed to viruses, it helps their immune system recognize those things as foreign. So if they get exposed to those things again, their immune system can attack them more quickly, which is why kids in their first year of school, if they've not gone to daycare, or the first year of kids' daycare experience, they tend to get more viruses because they're now being exposed to things they weren't exposed to before. Their body's now mounting an immune response, making tons of antibodies. So when they get exposed that second time or third time or 10th time, their body recognizes it as foreign. The army kind of launches in and attacks those things, which is why kids the first year in daycare, first year of school, get 13 to 14 viruses in the year. So super common, whereas we as adults don't get 13 to 14 viruses in a year, not typically anyway. So yeah, your child may get reacquainted with those viruses when they go back to daycare or school settings, but that would happen every viral season anyway, typically. Again, as we were saying before, viral season is upon us and kids are going to get sick as they always do. But I'm not worried that their body's suddenly not going to recognize viruses or recognize things that are foreign because they haven't been in daycare setting for 3, 4, 5 months. I'm not worried about that at all. But going back in during viral season or right before it, there's no doubt kids are going to get sick, but they were already going to get sick. We just have this added stress of like, what is COVID and what is flu and what is, a normal cold now, because that's the piece that's difficult to tease apart.
Absolutely. Going back to sleep a little bit here. Any tips on how to keep my 16-month-old to sleep through the night? She wakes up every 2 hours and doesn't fall asleep until midnight, even though her bedtime routine starts 2.5 hours earlier.
Goodness gracious. Okay. I really think you should join the parent playbook. There's going to be a lot of us to unpack. I mean, and I don't know enough about the story to really counsel that well. But, as I was mentioning, kids at 2, 3, whatever, should be getting 11 to 13 hours of sleep at night. A 16-month-old absolutely needs 12 hours of sleep at night and 2 to 3 hours during the daytime. If a child is taking 2 to 3 hours to put down, there's something amiss. There is something awry. There is lots to be working on here. It should not be taking that long to put a kid down. Usually it's because they're, again, doing this behavioral stuff where, I'm crying, I'm having temper tantrum, I want to feed again, all this stuff. And parents often have difficulty navigating like that time. What do you do when your child is really fussy? What do you do when your child is crying? Do I cry it out? Do I do graduated extinction? Do I sit in the room with them when they're falling asleep? Should I lie with them while they're falling asleep? Should I leave when they're awake? Should I leave when they're asleep? Like all these pieces, there's so much to this story. So it's impossible to counsel kind of a one-on-one without knowing more of the story. Again, this is where like a parent playbook is really helpful because you can actually ask, our sleep expert, Rosalie, or any of us, the team of 12, child health and parenting experts, psychologists and social worker and physiotherapist and speech therapist and physician and sleep expert and dietitian, all of us that literally are one-on-one, in this membership, answering people's questions on a specific basis, just as you presented, but with much more detail. And we have all these resources, videos, Q&As, live Q&As at least once a week, sometimes 2 or 3 times a week with our experts, videos, all sorts of things. So like, I feel like you'd be a really good person to join the playbook if you're interested. But it shouldn't take you more than half an hour to put your child down. Your child at 60 months should go down ideally around 7 p.m. or so to then wake up at 7 a.m. or so, about 12 hours of straight sleep. A child at 16 months doesn't need any feeding, any water, any bum changes, anything at night. They should be allowed to self-soothe without needing any parental intervention. And if a child isn't doing that, then there's probably quite a few things that need to be worked on, but that'd be something that we need to know more details about. But waking up every 2 hours shows me that the child is not able to self-soothe and isn't able to settle. They're relying on a parent or a caregiver to do that work for them, whether it's feeding to sleep or rocking to sleep or holding their hand to sleep or whatnot. And the goal for me is that kids learn how to independently self-soothe so they don't need a caregiver there all the time, because it's not good for you. It's not good for them. They're not getting a straight stretch of consolidated sleep. And you as a caregiver aren't either. And that's not good for anybody, right? There's nothing positive about that. That is just not a good thing. Yeah, it sounds really hard. 16 months of that is really, really hard.
Absolutely. And we'll talk more about the parent playbook and how everyone can access it at the end. Here are next, staying on the sleep train a little bit. How can you stop your child coming out of their bedroom once you've done bedtime and said goodnight? Sometimes she comes out 6 or 7 times, and it, of course, becomes tiring and frustrating.
Of course, yeah. So this is attention seeking, right? So you want to make sure that you kind of fill up your child's bucket throughout the day, so they don't feel like they need that extra attention at nighttime. If you think about your bucket of like attention, if you give tons of attention during the day and positive experiences, positive, etc., they're going to be less likely to need that time from you. And usually that's the time where like you need for you've stuff to do, laundry, cooking, time with your partner, relaxation time, like evening time when our kids go to bed. Like, my kids are very quiet. I mean, you haven't seen or heard my kids. I'm in my office, in my house, and I put my kids to bed at 7, including my 7 and my 9-year-old. In my house, all 4 of my kids go to bed at the same time. My big kids for sure are reading or doing Lego or something, but they're quiet. My kids know that like at 7 p.m., I'm out. Do what you need to do to be quiet and hang out. You don't have to fall asleep at 7, but I'm absolutely not intervening. Like, you're doing your own thing. And that's true of my 2-year-old too, who goes to bed independently. And I say, peace out. I'll see you tomorrow at 7:30, or sometimes even later. It's important, I think, to teach kids how to, or enable them, or allow them to learn how to be independent. If a child is leaving and leaving and leaving and coming and going, whatever, it's because they're not getting enough attention, or maybe you're giving tons and tons and tons of attention, but now they're seeing it as an opportunity to like delay and get that really undivided attention. I see this often in single kids, but even more often in kids where they have siblings as well, where parents are often dividing with other siblings. And then now this is the time I'm going to get by myself, and my brother is sleeping or my sister is sleeping. So a couple of things. I mean, it depends on the age of the kid. I don't know enough details, but if your child is younger than 3, I personally keep kids in cribs. A crib is a safe cage, if you will. It's a safe space. A lot of people think that once your kid can jump, or once your kid's asking for a bed, that we should necessarily switch them to a bed, but they're no longer in that safe cage. And the concern is that they leave their room, perhaps in the middle of the night, it's pitch black outside, and you're sleeping in your room, you're not aware that they left. And I've seen some really scary things. Okay. I've seen kids fall downstairs. I've seen kids play in bathrooms. They were like half asleep or even like sleepwalking and I've seen some really devastating things. I'll leave it at that. So I think it's safer. I know it's safer to keep kids in their crib as long as you possibly can, including even taking the metal mattress part thing of the crib and removing it, and even dropping the mattress on the floor, as long as there's not a space to like get out or like get their arm or leg stuck or something. Many cribs, there's not so much space at the bottom that you can drop the mattress on the floor and still be in that safe cage, but it buys you an extra 6 or 8 inches sometimes where they are not at risk of jumping out. Now, of course, if your child's jumping out and it's unsafe, you have to switch them to something else. But the kids that keep leaving at nighttime, especially over nighttime, I have very low threshold to do something like put a gate on their door. Because again, I'm really worried about these kids leaving at nighttime, sleepwalking, it's pitch black outside, you're not aware of them. It's different at like 7 or 8 p.m. when you're still awake, but in the middle of the night, if they come to find you and something bad happens, like that wasn't safe, right? So my second kid, my now 7-year-old, we had actually a lock on the outside of his door for about 2 years, because there were times that we'd find him in the bathroom, like playing under the sink. Like he was so curious. He's still so curious, and it wasn't safe. He wasn't trying to be a jerk. He wasn't trying to bug me. In fact, he was doing quite quietly, but I was scared for his safety. So I, in this case, put a lock on the outside of his door. Like we took his handle, we flipped it. So he couldn't lock it from the inside. We could lock it from the outside. And a lot of parents think that's crazy. That's so mean and rude and dangerous. I don't think it's any more dangerous than putting a kid in a crib. God forbid there's a fire, you have to unlock the door and get the kid, or if they were in a crib, you'd have to go into the room and get them from the crib. I don't think it's any less dangerous. Again, they're in that safe cage. Whether the cage is the cage of the crib or the cage is their bedroom, sometimes it's safer, right? If your child's not leaving and they're like respectful and staying in their bed at night, great. I mean, you don't need a lock. But if your kid's doing unsafe things like leaving 6 times a night or every 2 hours at nighttime, again, they're not getting good stretches of sleep. That is not good for them. That is not good for their brain, their growth, their development. It's not good for you to wake up every 2 hours. It's obviously terrible for you because you're exhausted as a parent, and then you're not going to be the best parent you could be, of course, because you're exhausted. And, no one is doing well if you're waking up every 2 hours when a child is 2 or 3 and, out of a crib. No one is doing well with that. Parents can manage that for like 4 to 6 months of waking up every 2 hours. We're like, we can do that as parents because we have to when we're feeding every 2 hours. After that point, no one does okay with waking up every 2 to 3 hours. It's just not good for us. So I would strongly consider getting back in the crib if it hasn't been too long since you've done that. And or I would think about, making it inaccessible to leave with something like a gate or a simple lock, because it's not safe. It's not safe.
Perfect. Thank you. Our next question is, do you have any tips for managing biting in a 2-year-old or older?
So, this is similar kind of behavioral stuff as we spoke about before. And you can see all these questions are in the same realm, right? What all parents have concerns about in toddlerhood is eating, sleeping, and behaviors, period. I get very few questions about development at this age group because every parent goes through the exact same thing. Even if you think you're the only person that has this issue, everyone has the same issues, really. Like I do the same counseling on every topic all day, every day, all day, every day. It's just what everyone is concerned about. So biting and any other kind of violent, aggressive behavior, I personally have zero tolerance for. Zero. It's not the same as a temper tantrum. It's outwardly aggressive and it's potentially dangerous and it's gross, right? If you come home from work and you heard that your child was bit, there's this innate, disgust, if you will, because it's someone's mouth on your kid, especially with like broken skin, etc. They're just like it's violent. It's really quite violent. And a lot of kids react out of frustration, and they would do that in a temper tantrum, or they react in a physical aggressive way. And I think that's just our innate, as people, just as animals are, we sometimes react aggressively. So similar to what we talked about before with temper tantrums, you want to give a lot of attention for the calm and not give attention for the crazy. But I would escalate that in the case of violent behavior like biting, and that there should be some kind of consequence. So I see this often. A kid, you're holding them, you're playing with them, and they bite you. It's attention seeking. For that, if it's not like really aggressive, it's just sort of like attention seeking, like they think it's funny. A lot of like toddlers will bite and they'll giggle. They think it's hilarious. A lot of us then we say, no, don't do that. No biting. But again, you're giving them attention for it. So for those kind of kids that are not trying to be mean and aggressive, if I'm holding them, I literally will do the same thing. I'll put them down and I turn my back and I walk away. When they calm down, that's when I give attention back. And then I'm going to talk about the fact that you shouldn't be biting. But in the moment is not the time to be scolding. Again, a lot of kids think it's funny. We see this a lot. Kids bite and they go, ha, ha, ha. And you're like, what? You just hurt me. What? That's not cool. And parents will often say to me, like, do you think there's a problem? Do you think they're like a sociopath? And I'm like, no, they think it's funny because you reacted. Don't react. Put them down, turn your back, walk away, and then come back when there's, less crazy kind of behavior. For kids that's not yet enough, and it depends on the age of the kid, I would maybe consider taking that child and putting them somewhere else. So I say time by yourself. People call it time out, whatever you want to call it. I call it time by yourself because I don't want it to have really such a like negative thing. Like time out seems, I don't know. In my head, it's just kind of negative. I say time by yourself. Basically, you need time to kind of think through what's going on. You're feeling frustrated. I don't want you to be with me with that negative energy. You're totally allowed to feel, discomfort. You're allowed to feel frustration. You're allowed to feel hungry or tired or sad. But I'm not going to give you attention for acting that out in a negative way. You get to calm, you're going to chill out. And then when you're calm, then we can talk about it. The example I give is, a really bad day at work, a really bad, experience with your partner, really bad, discussion with your boss, whatever the case is. And you come home and you're like so mad. Some of us will like go for a run, or some of us will like use a punching bag, or some of us will go scream into a pillow. But that isn't typically the best time to discuss it with your partner or a friend because you're just like so mad and angry and whatever. Usually people find they kind of like think about it, they calm down, they kind of collect their thoughts about it. They might still be really, really mad, but it's not in that like initial things are really angering me, We just need to chill, we need to think through what happened, and then is a better time to discuss it with our partner or friend or whoever is our person. For kids with temper tantrums, I let them have their temper tantrum. You're allowed to feel frustrated. You're allowed to feel whatever feeling you're feeling. I'm not going to say not to temper tantrum. The violence is different. We'll come back to that again. Do your thing, get your ickies out, I say, and then I'm going to give you attention for it. So do what you need to do to like get that nervous energy out as long as it's safe and non-violent, and then I'm going to give you attention for it. For violent behavior, I think we have to be very swift and very strict about like, no, you're not allowing that whatsoever, not once, not ever. Because if a kid is biting you, they're going to bite a friend. They're going to do it for attention, or they're going to do it as a lash out. And I want nothing to do with that. A child is never allowed to be violent, period, end of story. It's never okay. It is normal to experiment with that, but it's never okay to allow it to happen ongoingly. Kids that repeatedly bite, it's not okay. We have to set boundaries on that because, again, it's gross. They're injuring someone else. And again, oftentimes the reaction from the other person is what they're seeking. And we don't want them to be seeking that reaction because it's not a positive reaction. So if a kid is biting you in a funny way, again, put them down, turn your back, walk, come back to them when you feel is appropriate, and then explain to them that it's not okay. Again, when they don't think it's funny. For a kid that's biting other children, what I'll typically do is I'll remove them from that situation. Or if you think that that gives too much attention to that child, I will remove the person they bit. Or let's say it's a sibling, I'll then go give attention to the sibling who was bit and walk away with the sibling, again, leaving the child who bit the other person alone. And then if that's not enough, then you're thinking about the next kind of consequence. Is a timeout or time by yourself? Is that something that's going to change their behavior? Some kids, yes, some kids, no. Some kids think that a timeout is hilarious and they don't care about it at all. They're like, okay, I'll go to my timeout and then I'm going to walk right out 2 minutes later. And they're not bothered by it. If it doesn't faze them, it's not going to be helpful punishment or, an outcome. Perhaps they don't get their favorite show that they were otherwise going to get that evening. Perhaps that's something that you use to your leverage. Perhaps they don't get that extra special story time with mommy that night. Whatever the case is, it differs maybe day by day, kid by kid, age, now, 6 months from now, etc. But you want to make sure you're swift with it and you're consistent with it. Otherwise, you're going to have a kid that keeps on acting aggressively, and you want none of that. That is so much worse than temper tantrums.
Makes sense. Our next question is, due to COVID, we've increased the screen time for our toddlers, 2 and 4 years old, since we both need to work at the same time from home. How much screen time is too much? Would there be any long-term effects from this?
It's an excellent question. I'm glad you're asking it because it has been a really big challenge for people in COVID, especially when you're having 2 parents or 1 parent working from home. It's a very big challenge. So the official recommendation from the Canadian Pediatric Society and the American Academy of Pediatrics is that kids less than 2 should have 0 minutes of screen time per day. 0. Kids 2 to 5 have 1 hour total of screen time in 24 hours, and kids more than 5 have no more than 2 hours of screen time per day. This is cumulative screen time. This is the iPad and the computer and the TV and your phone and any other screen that they look at. It could be 10 minutes at a time or 1 whole hour at a time. But kids less than 2 should have no screen time, and kids 2 to 5 should have no more than 1 hour of screen time. Again, it's a challenge, but it is the recommendation. And the recommendation is based on hundreds of thousands of studies that show that screen time is bad for kids. It just is. It increases aggression, violence, poor behavior, poor sleep, increases obesity, vitamin D, oh, hello Siri again, high blood pressure, high salt levels, weight, what else, lipids, like cholesterol, poor vision, poor word acquisition, poor emotional IQ, poor academic IQ, poor social relationships, like so many things. Screen time is bad for us. Ironically, we're on a screen right now. And I spend a lot of time on a screen. I do with my job and the work I do, but screens are not good for us. And they're ubiquitous. They're everywhere. I know 4-year-olds that have iPads in their rooms. I spoke to a family today. The kids are 3 and 5 and they have a TV in their bedroom. It's not good for us. It's just too much. It's too much. And screens now, what kids are watching is very different than the screens that we watched when we were kids. And I know this sounds like this grandmother thing, like when I was in school, I used to walk up a hill. But really the screens we watch now are very different than before. For one, kids have access to often iPads or computers in their bedrooms or by themselves, and they're watching all the things that we have no idea what they're watching. Even if you put on, YouTube for kids, you have no idea what they're being fed. Every minute they're getting ads and they're getting pop-ups and everything, and you have no control over that. You really don't, no matter what you're putting on for them, unless it's a show that you're watching in front of them. And if you're working, you probably don't have the show on in front of you. The whole point is that you're trying to have them out away from you, right? So I really don't think kids should be watching anything on YouTube. Even YouTube kids, they're getting fed tons of ads, tons of things that they're being brainwashed, quite frankly, by very smart marketers. They know what they're doing. They're trying to get your kid hooked on various things very, very early on. Ideally, you're watching with them, you're curating that content with them, and it's for very finite amounts of time, which again is challenging. I'm not saying it's not challenging. COVID sucks, being at home working sucks, having your kid home from daycare and school sucks. Agreed. I'm on the same, as you, but they're getting a lot of screens, and again, you don't know really what they're watching. The other thing is, I really don't think, 2 and 5-year-olds, I really hope they're not on social media, but young people should not be on social media. Again, they're being fed things. I'm on TikTok, I'm on all social media platforms, but I have a big following on TikTok. And what I'm realizing from all my comments on TikTok is I have a lot of very, very young people that are following me on TikTok, which is not good. TikTok in particular feeds you content they want you to see. It's not just the people that you're following, like you would have on other platforms. TikTok like puts new content in front of you that you have absolutely no control over. So, you know, I'm scared of some things that I am fed on my own TikTok as an adult. So you really want to make sure that you're curating the content for them. It's really important because you really don't know what they're being fed as consumers of the media and of the social media. But yeah, unfortunately, the recommendation for a kid less than 5 is going to be 1 hour max a day total.
So hard. Okay.
So hard. I know.
Unfortunately, we're out of time for today, but before we go, I just want to chat a little bit more about the parent playbook, and for anyone who didn't get their question answered, where they can go to get more information. And so maybe you can just give us a little overview of the playbook, Dina, and then we can talk about the special offering for our parents.
For sure, yeah. So the Parent Playbook is a membership group that I put together with 11 other social media friendly superhero experts, as we call them, of parenting and child health. So as I mentioned before, we have like a speech therapist and a physiotherapist and a sleep expert and myself as a pediatrician and psychologists and social workers and a variety of team members that are experts in child health and parent health and kids health and parenting in general. You know, as we were mentioning, there's so many people that have so many questions about sleeping issues and feeding issues and behavioral challenges, and it can be hard to navigate these things. And many people feel like they're the only people going through this. My kid's the only kid that's waking up every 2 hours. My kid's the only kid that won't stop sucking their thumb. My kid's the only kid that won't sit with us at the dinner table. But in reality, these are very, very common woes. And oftentimes we are exhausted and frustrated and at our wits' end, and especially having been home with our kids for a number of months, a lot of parents are feeling really, really stressed out and they don't know how to manage these various things. And so you might be feeling you're giving in more often, or that meal times are not really enjoyable, or you're not getting as much sleep or rest as you can, or you know, the very many things that are challenging in parenthood. So we put together this membership where we provide a few different things. One is we have tons of content that's in the form of video and audio and PDFs on topics of all sorts. So, you know, how to prevent picky eating, how to make sure that your kid, is preventing viruses, how to make sure that you have the adequate wake window for your kid. How do you know how long they should be awake for before nap time? How do you teach your child to self-soothe at night? What do you do about your kid waking up in the middle of the night multiple times? What do you do if your child is having challenges at the meal table? What do you do if your child won't have anything with calcium? What do you do if your kid only wants carbohydrates? All these many things that we counsel on very often to other parents, as parents ourselves, as experts in parenting ourselves. So there's all this content. We have a private Facebook group where you can literally ask one-on-one to any of our experts or all of our experts your various woes, exactly as you guys had sent in questions today, and we can answer you and go back and forth and see how things are going and tweak this and tweak that in a really live environment. And we have live Q&As very frequently, just like this one, of all of our experts. There's at least 1 or 2 per week, every single week. So there's lots of access to us. You basically have an access to, one-on-one all of our experts on our team and the content as well. So that's the Parent Playbook. And we're closed to new members. We're not currently open to new members, but we thought it'd be cool for all of you guys to open it in a flash kind of sale way for the next 3 days. So if you wanted to join, you can. We'll be open just to kids and company, families. We'll open it quickly. We'll close it again because we don't want it to be so big that people don't get that, boutique kind of personal experience with us and our experts. So we'll be opening it just for you guys, just for the next 3 days, and we can send out some information afterwards and a link to where you would go to learn more and to sign up if you want.
Yeah, that's amazing. Thank you so much. So I did put the link here in the chat for everyone to learn more and see where to go. And then we will be sending a follow-up email with more information. And you'll have until Sunday, this coming Sunday, August 2nd, to take advantage of this exclusive opportunity. So thank you so much for that, Dina, and for your time tonight with this question and answer. Thank you, everyone, for joining us and bringing in your questions. As I said, if we didn't get a chance to get to your question, then feel free to reach out to us directly and we can work with you one-on-one.
For sure, for sure. And you guys, any other questions you didn't ask, or you have questions about the membership, or questions that we didn't get to answer today, you can absolutely, reach out on social media. I'm at Dr. Dina Kulik at Instagram and Facebook and TikTok and all of it. And if you want to ask specific questions about the membership or specific kind of, questions about parenthood, etc., hello@parentplaybook.co. hello@parentplaybook.co. We can link that as well, and you can shout out to us, and I'm happy to help you.
Perfect. I'm just putting that email address into the chat here for anyone who needs it. Thank you again for joining us, Dina, and everyone for asking your questions. We hope that everyone has a great evening.
Bye, guys. Have a good one.
Bye.